recognize the gentleman from Arizona, Mr. Schweikert, to inquire.
Thank you, Mr. Chairman, Mr. Secretary. And look, you have a great reputation as a verbal scrapper. I need to step, and this isn't where I wanted to go, but being someone who's from Arizona, who was down on the border last Wednesday and just seeing the chaos, also being from Phoenix, it's the epicenter of distribution of fentanyl, and my list of children who are dying or who have died. Our argument is the Border Patrol is basically now a concierge service. They pick up people, they put them in their trucks, they take them for processing, and entire sections are open because they're managing moving people. And the math is the math. I mean, when a year ago it cost, what, like $112 to get high in Phoenix, and today it's $12. This is not a Democrat problem. It's not a Republican. It's almost dystopian. And if you truly care about health and people, I mean, come to my neighborhoods and let me show you where I have zip codes that homelessness has doubled, where I have, I mean, there's something evil, destructive, heartbreaking happening. Now for the next bit of that's going to seem a little strange, I'm going to actually echo Lloyd Doggett on a couple things. So, you know, I'm on the right, and the telehealth. Whether you know it or not, years ago you actually did something, I think in this room, where you talked about, I have this intense frustration when you talk about the ACA, or we talk about our Republican alternative, or some of our more left members talk about Medicare for All. You're talking about financing it, who pays and who gets subsidized. I want to beg of you, what can we do to disrupt the actual cost? Not who pays, because we're not like what the left just did in regards to insulin pricing. As Mr. Doggett said, we're functionally taking $20 billion and subsidizing the very companies that you all accuse of gouging. We're handing them $20 billion instead of the co-ops that are about to go online, you know, that say they're going to do it at $55 for a box of 5, under even the subsidized price. Why didn't our policy work to help them bring those market disruptions faster? In that same concept, the telehealth that many of us are working on, please think about not telemedicine, but telehealth, the wearables, the move. What can we do there? Because we proved seniors know how to work their phone. How do we use that as a way to disrupt the price as well as the accessibility, and not just by zip code?
Congress, first, if I can say, thank you for the thoughtful and cogent way you've articulated the positions. And so let me try to be responsive to that and say, you're right. It can't just be about trying to subsidize a cost. It's about reducing the cost. I would say to you that you talked about wearables. The more we can get into some of those, the quicker we can reduce costs. You know and I know that CBO sometimes, the Congressional Budget Office, sometimes gets in the way because what they see as a savings may not be what you and I agree is a savings.
You actually have some very good staff that did a report about a year ago on the discussion of sometimes a curative, we may not see the real economic value for a decade plus, and we're scoring in this window. So yes, your point is taken.
And so we're absolutely willing to work with you because there are some things that on a bipartisan basis we can do that will reduce costs, not just mask the cost. That will be good. It's just we have to get through it. Most of it will be statutory. Well, you all have to do it, then we have to execute. And so look forward to working with you.
It's disruptive. It's uncomfortable. We have $120 trillion of debt coming at us over the next 30 years. 75% is the shortfall in Medicare. If you're going to save Medicare, we got to do the disruption. And with that, I yield back, Mr. Chairman.
I look forward to being disruptive with you.
Thank the gentleman. Let me recognize the gentleman from